One of the questions I get asked all the time with filler is what is or isn't normal after getting your lips filled. So I thought I'd quickly answer it while I'm laying in bed doing some admin on my day off. So let's get to it. So for starters, swelling. Swelling is completely normal after you have had filler. That is because of needle trauma. If your tissue is getting jabbed and jabbed and jabbed and fanned with a needle, you're going to swell. It's going to cause a bit of trauma. There's going to be a bit of swelling. Also, because the filler, majority of filler that is used, unless a clinic specifically doesn't use it, does contain lidocaine. And lidocaine is a numbing agent. So when that goes into the lip, it does cause a bit of swelling, and that is completely normal. Your swelling usually lasts a couple of days. It will be worse like the day and the day after you've had your treatment done. Be prepared. Let me show you a photo of how mine looks after 0.5. You ready, girls? Be ready. You thought I was lying. I wasn't lying. This is me after 0.5 of filler. I am a sweller. However, there are things we can do to try and avoid the swelling, such as cutting out the caffeine a good few days before your appointment, cutting out the alcohol, cutting out fags and vapes, and also making sure that we drink loads and loads of water. Energy drinks do count as caffeine, girls. So if you come in drinking a bottle of Monster, can of Monster, whatever it's produced in these days, you're going to swell. Be prepared to swell. It's going to happen. The next one is bruising. Do not panic if your lips bruise, okay? Understandably to you, it may look quite bad, but to us, we go, oh, it's just a bruise. You're all right. You're absolutely fine. If you've got a needle going in at your lips, especially if you're having Russians, you're probably going to bruise, and likelihood is you see more people bruise than they don't. Obviously, if we could make sure that no one bruised, it would be an ideal world for us. But do not panic if you bruise. It's completely normal. Sometimes we get what we call little hematomas, and that's where the needle, because we haven't got x-ray vision, nicks a blood vessel on the way through, bit of blood comes out, it's just a crappy looking bruise, okay? But bruising does go down. It is not the end of the world. However, if something doesn't look right, you always contact your practitioner and they will basically double check for you. However, bruising is totally normal. And do not worry if you do bruise, it is not the fault of your practitioner. The amount of clients I'll have say to me, oh, I went somewhere before, but they made me bruise. Yeah, you probably will bruise, and you'll probably bruise with me, or you'll bruise with a woman down the street, or you could go to some amazing doctor or dentist or nurse or a non-medic. You probably will still bruise because we're all doing the same thing. It's all the exact same treatment, so you probably will bruise. So do not panic if you bruise. Sometimes bruising can track up and down. If that does happen, then you do contact your practitioner. A lot of the time it is just bruising. It is how it is. However, anything like that, you contact your practitioner straight away anyway, because we will always want to double check it. Now, how are they going to feel? They are going to feel so sore. After you get your filler done, they are going to feel tight. They are going to feel sore. I get a bit of pain in like my teeth when I get my lips done. It does hurt, okay? Especially when that lidocaine and that filler wears off, that numbing has started to wear off. They're going to be tight, they're going to be sore, and they're going to hurt. You're going to end up falling asleep with a nice pack on your face. Some people don't mind the pain. Some people do find it a little bit worse than they kind of would expect, but they are going to be tight and they're going to be sore. And the tightness is because we are essentially expanding that lip tissue, so they're going to be tight. Now, lumps. Lumps is a good one to talk about because sometimes within our 2-3 week healing process, lumps can appear and then they'll go down and they'll settle. So I always tell my clients that for the first 2 to 3 weeks, lumps, bumps, swelling, bruising, a little bit of unevenness and tightness, perfectly normal. If after your 2 to 3 weeks you are still experiencing lumps in your lips, contact your practitioner. They might just need a bit of lancing out, it might need a saline flush, or it might just need a bit of a heat and a massage, and it will go down. But sometimes, like I know with mine during the 2 weeks they do go a little bit lumpy and then they settle really nicely. Everyone settles differently, so do not panic. Now, quickly going over things that don't look right, and obviously your practitioner will always teach you this before you leave. A good practitioner will always teach you how to do your cap refills before you leave as well. Not because they're concerned about anything, just because they want you to know kind of standard aftercare really. So if any of your lip starts to go mottled or white, and your capillary refill is where you hold down really hard, you're going to watch here, and then you let go, you see that's gone from white back to pink. That's perfect. That's what we want to see. If that cap refill isn't coming back and it's taken too long to come back, it's staying white, then it means there's a potential blockage there. So what we'll always do is get you in, have a look at it, and absolute worst case, we dissolve it, okay? So obviously if it's treated efficiently, it's treated quickly, there isn't going to be any issues. However, obviously that is a big thing to look out for. If the skin becomes mottled, it becomes like your cap refills are coming back slow, anything like that. If it's becoming really swollen, like cold and painful to touch, anything like that, then regardless, you always contact your practitioner anyway. But any good practitioner will get you in and just see it face to face. 99% of the time, it's nothing to worry about, but they will always bring you in. But that's essentially what it's going to be like after getting your filler done. So don't panic if you swell. Don't panic if you bruise. Don't panic if it feels tight and it hurts. It feels a little bit lumpy bumpy. That's normal. But at the same time, if there is anything you are not sure of, you message your practitioner and they will always put your mind at ease, or they'll get you in, check it, and just double check that everything is A-okay.